Hi, this is Dr. Chelsey Smiley here. I've been talking about different conditions and things that I've been dealing with my pregnancy, and then I know that a lot of other pregnant women are also dealing with. Last week I talked about headaches and how I've been dealing with those. This week I'm going to talk about leg cramps and restless leg syndrome, mainly at night. Mine started about my second trimester, which is a common time with a growing uterus that starts happening at night. Mine mainly wake me up in the middle of the night with a full-blown cramping, or Charlie horse that we like to call it. So I've been dealing with that, and of course I've been trying to figure out ways to help prevent that and help decrease the frequency, because as you probably know, they are extremely painful. Some of the things that I found to help prevent them from happening, or also decreasing the frequency, is making sure that you're drinking plenty of water. Recommended for pregnant women is probably about 10 cups a day, which is about 2.3 liters. I know that sounds like a lot, but you definitely need a lot of water. If you're working out, you want to add about 1.5 to 2.5 cups on top of what you're drinking for every hour that you're working out. So definitely make sure you're getting enough water. I try to eat a banana every day for the extra potassium too. Make sure you're taking your multivitamin every day. The vitamins and minerals in that can really help as well. One thing that I've tried too is I actually got a pregnancy pillow. Let's see, mine's the Snuggle Total Body by Leachco. It's very big, so it took a little time to get used to it. But that's definitely helped, because what it does is keep your pelvis in line at night, makes you more comfortable so you're not twerking out and putting extra pressure on your belly or on your legs. So try that too. Yeah, I still might get the restless leg syndrome every once in a while and get a cramp, but it's definitely decreased the amount of times that it's happened. Also, making sure you're stretching every day, especially the calf muscles. I'm going to show you in a minute here some basic stretches that you can do every day to make sure those are stretched out and they're not tight, because that'll increase the frequency and chances of that calf cramp happening at night as well. Also staying active, making sure you're exercising, walking daily, keeping those muscles conditioned also helps as well. I've also been trying recently some Epsom salt baths, and I feel like that really calms the muscles down. I'll usually do that at night before I go to bed. Make sure it's warm water, not too hot. I stay in there about 15 minutes, and that seems to calm my legs down, so when I get in that horizontal position, I'm not dealing with those issues as much. Let's see. Also, I want to talk about what happens when it strikes. So once that goes into full cramp mode, I read a lot of things online about how you should flex your foot the minute it happens. When I do that, it goes into full-blown attack mode. It's actually happened like back-to-back 3 times. So I steer clear of doing that anymore. I'll just let the cramp finish. I'll usually get up. Make sure you're very careful when you're getting out of bed, because sometimes it's very sore and hard to put pressure on that leg. But I'll walk around. Once I feel like that's calmed down a little bit, I will stretch my calf out a little bit, drink some water, and try to get some sleep again. So that's what's helped me. Everyone might be a little different, but see what works for you too. My husband also adjusts me at least once a week, sometimes 2 times a week, to make sure my pelvis is in alignment, my hips are in alignment, because that can add extra pressure to your lower back, make you more uncomfortable at night, and put you in a funny position to possibly have that cramp again in your lower leg. He also checks my ankles, my feet, and my knees too, because if those joints are locked up, they can put extra pressure on those muscles, again increasing your risk of that muscle spasm at night, which I know we want to decrease the risk as much as possible. All right, now I'm going to pause for a minute, and I'm going to show you those calf stretches that I was talking about. Here are the calf stretches I was talking about. I'm going to go ahead and demonstrate those for you. So find a wall where you have enough space. If I was stretching the left lower leg, I'm going to bring the left leg back, keep the heel and the foot flat on the ground. I'm going to lean forward a little bit with my right leg, hands against the wall. You want to keep your head and chest up, and you're going to lean towards the wall, almost like you're doing a push-up. And you should feel the stretch in that left lower calf. So that's a basic stretch. You can hold that for about 20 to 30 seconds. You can also add a little more of a functional stretch to it where you're moving in 3 different directions. So what you can do is you can lean forward like you're doing a mini push-up for about 10 reps. And then you can turn to the left for about 10 reps. And then you can also turn to the right for 10 reps. And you kind of feel that in different portions of the muscle, so you feel different portions of the muscle stretching. And then you'll switch sides and then also do the right side as well. And if you have a foam roller at home, sometimes I'll also foam roll my calves out too while I'm sitting on the ground, so that's an option as well. But everyone should have a free wall to be able to do this. I hope that helps. Try those out. Thank you. All right, thank you everyone for listening. I hope I've helped somebody out there with my experience and some tips that I have. Try those stretches as well every day, and stay tuned later this week for a video of my husband adjusting me. Thank you all. Bye.